Welcome to today's lecture on Zollinger Ellison syndrome, ZES, a rare condition characterized by excessive gastrin production. We will explore the classification, localization, histopathology, and physiological role of gastrinoma, as well as its treatment options and clinical manifestations. We will also discuss the diagnostic challenges, molecular genetics, and management strategies for acid hypersecretion in ZES. Join us as we delve into this fascinating topic and learn more about gastrinoma and ZES. Gastrinomas, originating from pancreatic islet cells or duodenal mucosa, can be sporadic or hereditary. Localization is difficult due to their small size and variable location. Histopathologically, they exhibit neuroendocrine features and express the gastrin receptor, promoting growth and gastrin secretion. Gastrin, a peptide hormone produced by G cells in the gastric antrum, acts as a major regulator of gastric acid secretion. Once released into the circulation, gastrin interacts with the gastrin receptor on parietal cells of the gastric mucosa, leading to the secretion of hydrochloric acid. Additionally, gastrin enhances histamine release from enterochromaffin-like cells, thereby augmenting gastric acid production via activation of histamine receptors on parietal cells. This intricate interplay between gastrin, histamine, and parietal cells ensures the maintenance of adequate gastric acidity for digestive function. In Zollinger Ellison syndrome, excessive gastrin production occurs due to autonomous functioning of gastrinoma cells. These tumor cells lack the usual regulatory feedback mechanisms that suppress gastrin synthesis and secretion in healthy individuals. Gastrinomas may overexpress growth factor receptors, such as epidermal growth factor receptor, EGFR, and human epidermal growth factor receptor 2, HER2, leading to enhanced gastrin secretion. Furthermore, interaction between gastrinomas and the surrounding pancreatic islets can disrupt local inhibitory pathways, further exacerbating gastrin release. The treatment of gastrinoma depends on tumor characteristics. Surgery is the preferred approach for localized tumors, but may not be possible in certain cases. In those situations, medications like proton pump inhibitors are used to control symptoms and reduce acid production. The hallmark clinical manifestation of ZES is recurrent peptic ulcers that are resistant to standard therapy. Patients with ZES often present with abdominal pain, diarrhea, weight loss, and gastroesophageal reflux disease, GERD-like symptoms. Complications of ZES include bleeding from gastric ulcers, perforation, gastric outlet obstruction, malabsorption leading to nutritional deficiencies, and potential malignant transformation of gastrinoma. Prompt diagnosis and appropriate management are crucial to prevent these complications and improve the quality of life for ZES patients. The diagnosis of Zollinger Ellison syndrome, ZES, is complex because false positive and false negative results can occur. Medications that reduce stomach acid, like PPIs or H2 blockers, can give misleading test results. Certain medical conditions can also falsely elevate gastrin levels. Small or atypical gastrinomas can be difficult to find, leading to false negative results. Multiple tests and a thorough evaluation are needed for an accurate ZES diagnosis. Hereditary forms of gastrinoma, associated with MEN1 syndrome or NF1, can be attributed to specific gene mutations. MEN1 syndrome, an autosomal dominant disorder caused by mutations in the MEN1 gene, is characterized by the development of neuroendocrine tumors in multiple organs. Neurofibromatosis type 1, caused by mutations in the NF1 gene, is also associated with an increased risk of developing gastrinomas. Additionally, sporadic gastrinomas may harbor mutations in genes involved in cell cycle regulation and DNA repair pathways, further contributing to tumor development. Proton pump inhibitors, PPIs, play a crucial role in managing acid hypersecretion in ZES patients. These medications block the final step in gastric acid secretion by irreversibly inhibiting the hydrogen potassium adenosine triphosphatase, H+/K+ATPase, proton pump located on the parietal cells of the stomach. By reducing acid production, PPIs alleviate symptoms, promote healing of peptic ulcers, and prevent complications associated with excessive gastric acidity. Continued use of PPIs is essential to maintain acid suppression and ensure long-term symptom control in ZES patients. Accurate tumor localization is essential for treating Zollinger Ellison syndrome. Endoscopic techniques like endoscopic ultrasound and retrograde cholangiopancreatography can detect and confirm tissue samples. Radiological imaging modalities like CT, MRI, and SRS help locate tumors when endoscopic methods are inconclusive. Given the potential for metastatic disease in gastrinoma patients, risk assessment and surveillance strategies are essential for early detection of recurrence or spreading tumors. Imaging techniques such as abdominal CT scans, MRI, and SRS are employed periodically to evaluate disease extent and monitor tumor progression. Gastrin levels and associated biochemical markers, including chromogranin A and neuron-specific enolase, are also monitored to assess disease activity. Genetic testing for MEN1 syndrome or NF1 mutations is recommended for patients with a strong family history or clinical suspicion. In cases where metastatic disease is suspected, advanced imaging modalities aid in assessing tumor burden and identifying distant metastases. Positron emission tomography, PET, imaging with radiolabeled somatostatin analogs, such as gallium-68 dotatate, has shown promising results in detecting metastatic gastrinomas. This technique exploits the overexpression of somatostatin receptors on gastrinoma cells, allowing for targeted imaging and evaluation of metastatic spread. Additionally, selective venous sampling and liver-directed imaging techniques can assist in localizing hepatic metastases for potential curative or palliative interventions. In advanced or metastatic Zollinger Ellison syndrome, targeted therapies like somatostatin analogs or growth factor receptor inhibitors can be used to control symptoms and inhibit gastrin secretion, leading to tumor growth inhibition and improved outcomes in select patients. To summarize, it is vital for healthcare professionals to have a deep understanding of the complexities of Zollinger Ellison syndrome. By staying informed about the latest research and treatment options, we can improve patient care and outcomes.